I'm Dr. Thaddeus John Bell. Today I want to talk to you about men and heart health. I was in the barbershop several weeks ago having a discussion about health, and one of the things that I found out is that African American men did not know the most common causes of death in African American men. Heart disease is the most common cause of death in all men. I'd like to discuss with you some of the facts that I think you need to remember when it comes to preventing heart disease. Number one, you should know your family history. If your father died early of a heart attack or your mother died early of a heart attack, that's information that you want to convey to your primary care physician so that he can work you up or examine you to determine whether or not you have any risk factors. Secondly, we know that blood pressure is a major problem in the African American population. We're now beginning to see high blood pressure in many young African Americans. This high blood pressure also comes from family history. It comes from smoking too much, and it's not often talked about, but we know that a lot of young African Americans drink too much, which can elevate their blood pressure. Of course, weight control is very, very important. A common problem that many African Americans do not appreciate is that if you have a lot of weight around your waist, particularly with men, that is a major risk factor for having an early heart attack. And of course, not getting enough exercise on a daily basis is a major risk factor. So I'd like to encourage you to remember the risk factors that we have talked about. Remember, heart health is very, very important. It is the number one cause of death in African American men. I'm Dr. Thaddeus John Bell, closing the gap in health disparities for African Americans and for the underserved.